Indications and safety summary. Verzenio is used to treat certain types of breast cancer known as HR-positive HER2-negative, hormone receptor positive/human epidermal growth factor receptor 2-negative breast cancer. It is a medicine you can take if you have node-positive early breast cancer that has a high risk of coming back as determined by your healthcare provider. Verzenio is given along with hormonal therapy to women and men, or the cancer has spread to other parts of the body metastasized. If you are female or male, then Verzenio is given with an aromatase inhibitor as initial endocrine-based therapy. If you are female or male and the cancer has gotten worse after hormonal therapy, then Verzenio is given with fulvestrant. If you are female or male and the cancer has gotten worse after both hormonal therapy and chemotherapy, then Verzenio is given by itself. It is not known if Verzenio is safe and effective in children. Warnings: Verzenio may cause serious side effects, including diarrhea is common with Verzenio, may sometimes be severe and may cause dehydration or infection. The most common time to develop diarrhea is during the first month of Verzenio treatment. If you develop diarrhea during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, stop your treatment, or decrease your dose. If you have any loose stools, start taking an anti-diarrheal medicine such as loperamide, drink more fluids, and tell your healthcare provider right away. Low white blood cell counts, neutropenia, are common with Verzenio and may cause serious infections that can lead to death. Your healthcare provider should check your white blood cell counts before and during treatment. If you develop low white blood cell counts during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, decrease your dose, or wait before starting your next month of treatment. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Verzenio may cause severe or life-threatening inflammation, swelling, of the lungs during treatment that can lead to death. If you develop lung problems during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it, decrease your dose, or stop your treatment. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus,
chest pain.
Verzenio can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment. If you develop liver problems during treatment with Verzenio, your healthcare provider may reduce your dose or stop your treatment. Tell your healthcare provider right away if you have any of the following signs or symptoms of liver problems: feeling very tired, pain on the upper right side of your stomach area, abdomen, loss of appetite, bleeding or bruising more easily than normal. Verzenio may cause blood clots in your veins or in the arteries of your lungs. Verzenio may cause serious blood clots that have led to death. If you develop blood clots during treatment with Verzenio, your healthcare provider may tell you to temporarily stop taking it. Tell your healthcare provider right away if you have any of the following signs and symptoms of a blood clot: pain or swelling in your arms or legs, shortness of breath, chest pain, fast breathing, fast heart rate. Verzenio can harm your unborn baby. Use effective birth control, contraception, during treatment and for 3 weeks after the last dose of Verzenio, and do not breastfeed during treatment with Verzenio and for at least 3 weeks after your last dose. Verzenio may affect the ability of males to father a child.
Common side effects.
The most common side effects of Verzenio include nausea, abdominal pain, infections, low red blood cell counts, anemia, decreased appetite,
headache,
hair thinning or hair loss, alopecia,
tiredness,
low white blood cell counts, leukopenia, vomiting, low platelet counts, thrombocytopenia. These are not all the possible side effects of Verzenio. Tell your healthcare provider if you have any side effects. You can report side effects at 1-800-FDA-1088 or www.fda.gov/medwatch. Before you use Verzenio, tell your healthcare provider about all your medical conditions, including if you have fever, chills, or other signs of infection, if you have a history of blood clots in your veins, have lung or breathing problems, have liver or kidney problems, if you are pregnant, plan to become pregnant, or are breastfeeding, about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that contains ketoconazole. How to take. Take Verzenio exactly as your healthcare provider tells you. Your healthcare provider may change your dose if needed. Do not stop taking Verzenio or change the dose without talking to your healthcare provider. Verzenio may be taken with or without food. Swallow Verzenio tablets whole. Do not chew, crush, or split the tablets before swallowing. Do not take Verzenio tablets if they are broken, cracked, or damaged. Take your doses of Verzenio at about the same time every day. If you vomit or miss a dose of Verzenio, take your next dose at your regular time. Do not take 2 doses at the same time to make up for the missed dose. What to avoid during treatment. Avoid taking ketoconazole during treatment with Verzenio. Tell your healthcare provider if you take a medicine that contains ketoconazole. Avoid grapefruit and products that contain grapefruit during treatment with Verzenio. Grapefruit may increase the amount of Verzenio in your blood. Learn more. Verzenio is a prescription medicine. For more information, call 1-800-545-5979 or go to https://www.verzenio.lilly.com. This summary provides basic information about Verzenio, but does not include all information known about this medicine. Read the information that comes with your prescription each time your prescription is filled. This information does not take the place of talking with your healthcare provider. Be sure to talk to your healthcare provider about Verzenio and how to take it. Your healthcare provider is the best person to help you decide if Verzenio is right for you.